A fit founder, someone who meticulously tracks every workout, every heartbeat, every piece of biometric data about his body, walks into a hospital and gets one of the rarest cancer diagnoses possible. Non-Hodgkin's lymphoma strikes just one person in 420,000 people worldwide. And the tumor hiding behind his sternum isn't small, it measures 11 by 11 by 8 centimeters. His name is Conno Christou, founder of Keragon, an AI platform that automates medical practice administration. When he faced a choice between two wildly different treatment paths, one with a 60% success rate, the other with 85%, he didn't just trust the coin flip. Instead, he tried something unconventional. He fed his cancer data into Claude, an advanced AI model. Blood test results, medical imaging scans, wearable biometric data from his Whoop band and Oura ring, everything went into the AI. He asked it to help him truly understand the underlying science so he could make a genuinely informed decision. And here's what happened when an AI-literate founder used machine learning to fight one of the rarest diseases on Earth, and why this story might fundamentally reshape how we think about personalized medicine and treatment decisions. Most people have heard of cancer, but non-Hodgkin's lymphoma is different. It's a cancer of the immune system itself. Your body has white blood cells that normally fight infections. In lymphoma, those cells go rogue and multiply out of control. The thing about this particular type is how aggressive it is. It grows fast, and once it takes hold, it spreads quickly through the lymphatic system, that network of vessels and nodes throughout your body. With an 11-centimeter tumor already established behind Conno's sternum, doctors knew they weren't dealing with an early-stage case. This cancer was already causing real damage. The standard diagnosis involves blood tests, imaging scans like CT and PET scans, and sometimes biopsies where doctors take tissue samples to confirm exactly what they are dealing with. For aggressive lymphoma, early treatment is absolutely critical. Waiting even weeks can allow the cancer to advance further. The challenge? There's no one-size-fits-all approach. Some patients respond well to lighter treatment regimens. Others need aggressive chemotherapy. And for a rare diagnosis like this, finding the right path forward means grappling with incomplete information and probability, something that's where AI might actually help. So here's the brutal choice Conno faced. On one hand, there's a lighter chemotherapy regimen that doctors estimated would have about a 60% success rate. That sounds reasonable, better than a coin flip. But cancer doesn't work on averages. For a young, fit person with no other major health complications, the doctors also offered an aggressive chemotherapy protocol with an 85% success rate. That extra 25 percentage points might sound like a modest gain, but when you're talking about your life, it's enormous. The aggressive path means more intensive treatment, more side effects, potentially longer recovery. It means weeks of hospitalization, nausea, hair loss, immune suppression, and months of uncertainty. The question became obsessive in Conno's mind. Is the 25% improvement worth the trade-off? This is exactly the kind of decision that modern medicine struggles with because it requires you to truly understand probability, comparative outcomes, and how your specific body and circumstances fit into population-level statistics. Most people, and honestly, most doctors, don't have the time or the depth of training to really pass all the nuances. That's where Conno realized AI might offer something valuable. Could Claude help him bridge that gap and think more clearly about which path aligned with his values and his specific situation? Here's where it gets really interesting. Conno started feeding data into Claude, and not just one type of data. He gave the AI his complete blood work results, showing white cell counts, hemoglobin levels, all the markers that oncologists watch obsessively. He uploaded his imaging scans, the CT and PET images showing exactly where the tumor lived and how much metabolic activity it showed. Then came something most patients never think to add, his wearable data. He had years of fitness tracking from his Whoop band and Oura ring, showing his resting heart rate, sleep patterns, heart rate variability, and recovery metrics. He even added his personal journal entries describing how he actually felt day-to-day, fatigue levels, symptoms, psychological state. He poured all of this into Claude with a simple prompt: help me understand the science here. What does the data tell us about which path makes more sense for me? Claude started synthesizing. It wasn't offering a diagnosis, that's always the doctor's job. Instead, it helped Conno understand the underlying oncology, the statistical basis for those two treatment options, what the numbers actually meant, and crucially, what the data suggested about his specific fitness level and recovery capacity. The AI was basically saying, here's what the science actually says, so you can make an informed choice. Normally, here's how this works. A patient gets diagnosed with cancer. They sit down with an oncologist who has maybe 20 to 30 minutes to explain the situation and the options. The doctor draws on experience and training, but realistically, they can't synthesize every piece of medical literature on your specific cancer type. They're working from guidelines, from their own case experience, and from the limited time they have. For Conno, using Claude was completely different. First, Claude had absorbed vast amounts of medical literature, research papers, case studies, treatment protocols from around the world. Second, Claude could take all of Conno's messy, real-world data, his genes, his fitness level, his wearable metrics, his journal, and actually integrate it together in ways a human can rarely do in a conversation. Third, and this matters, Claude could spend unlimited time thinking through the nuances. There was no clock running. The AI could explore different angles, explain the statistical foundations, compare approaches without time pressure. Conno himself described it perfectly. AI helped me ask the right questions. For rare conditions especially, having access to a model that's absorbed full medical literature simply isn't the same as a Google search. You're not skimming blog posts. You're getting synthesis from the entire corpus of medical knowledge. This story points to something huge about medicine in the age of AI. We talk a lot about AI replacing doctors, and that's never going to happen with cancer or honestly with any serious condition. But what we're starting to see is AI augmenting medicine. It's helping patients and doctors make better decisions by synthesizing information at a depth no human could alone. Think about what this means for rare diseases. If you have a condition that affects one person in 420,000, like Conno did, your local oncologist might have seen 5 cases in their entire career, maybe 10 if they are lucky. But an AI model trained on global medical literature has seen the pattern across thousands of cases. It knows what works. It knows the edge cases. It knows the subtle interactions between treatment approaches and patient characteristics. For someone facing a rare diagnosis, that's potentially life-changing. The broader implication, personalized medicine stops being a buzzword and becomes real. Instead of population averages, you're getting recommendations tailored to your specific biology, your fitness level, your recovery capacity, your values. You're not just picking from the standard playbook, you're actually customizing based on data. That's a fundamental change in how medicine gets practiced. And it only works if patients have tools to help them think clearly about the information. So how would you actually do this if you got a serious diagnosis? First, gather your data obsessively. If you have wearables, Apple Watch, Oura Ring, Whoop Band, that's a goldmine. Get copies of all your medical records, blood work, imaging scans in digital format. Most hospitals can email these now. Write down a simple health history. What medications have you taken? Any surgeries? Major illnesses? Family history of cancer or genetic conditions? Bring all that together in one place. Then open an AI model like Claude or ChatGPT. You don't ask it to diagnose you, doctors do that. Instead, you ask it to help you understand the science. I have this diagnosis. Here's my complete medical data. Here's my fitness level and my wearables. Help me understand what the treatment options actually mean. What does the science say about which approach might be better for someone with my specific characteristics? Be specific. Share your actual numbers, your actual blood work. Give the AI real data to work with. Then listen carefully. Take what the AI tells you back to your medical team. Use it as a basis for a deeper conversation with your doctors. The AI isn't replacing them. It's giving you better questions to ask, better understanding of what they are telling you. For serious decisions, that kind of preparation is invaluable. Fast forward 6 months. Conno Christou is cancer-free. The aggressive chemotherapy worked. But here's the part that makes this story even more interesting. When he had his end-of-treatment PET scan to confirm the cancer was gone, the imaging showed something ambiguous. It looked like there might still be active disease. If Conno had panicked and trusted that image alone, he might have opted for radiotherapy to be safe. but he used Claude again. He had the AI analyze the medical literature on something called thymus gland rebound, a phenomenon where your thymus gland, which makes immune cells, sometimes reactivates after chemotherapy and mimics cancer on PET scans. The false positive rate for exactly this issue is about 60%. The probability of thymus rebound in his specific case was roughly 90%. Armed with that understanding, Conno went back to his doctors with actual data. Turns out, they agreed it was thymus rebound, not cancer. No radiotherapy needed. He avoided a major treatment he didn't need. This is the promise of AI in medicine, not replacing doctors, but helping patients become thinking partners in their own care. And that's why this story matters far beyond one founder's cancer journey. It signals a fundamental change in how we fight disease. Follow for daily AI news from the front lines of technology.